Hey guys, welcome back to your channel Dr. Batisi, and I'm your dentist Dr. Jasmine. So here we are with another video, and this is dental checkup camp. How to set up, what exactly to do, what exactly things to carry, how it is done, how a dentist can organize a camp no matter where. So, guys, either you can do it for your clinic on behalf of your own clinic or somebody where you are working for. You guys are going and organizing a camp. Number one. Number two, you can get associated with an NGO. On behalf of the NGO, you are going and setting up a camp. Number three, dentists are hired per camp basis by hospitals, by companies, by clinics. For example, if there is a huge camp, I know 500 people or patients will be getting their checkup done. So, I will hire at least two dentists to do the same if I am not a dentist but my company does the camps. So, I will be hiring dentists on their on my behalf. Then we are doing just for the awareness, or we are doing like in colleges during internship public health dentistry department. We usually used to go to a lot of camps just for diagnostics and treatment as well, because the college was associated with some village or rural population which needs that checkup and treatment, so we used to go there. So these are the different types on how exactly we can get associated with the camp, or we can how do a camp. Now guys, where do you camp? You can do it in schools, especially on the PTM day, because it's easy, because the children are coming with their parents, so easy to converse. Children might not understand what exactly the treatment needs to be done. So if it's better if it's done on a PTM, you can do in multinational companies, you can do in hotels, restaurants, villages, anywhere jahan people are there that can be served. There we can put a camp under the flyover bridges, some rural population, in any area, be it any cricket academy, any sports academy, any sports complex, anywhere there are people, we can do a camp. If you are doing for your clinic, you have your own clinic or working with somebody in the clinic and you want to set up a camp, so it's advisable not to go beyond 5 kilometers, because it's better if the people within 5 kilometers are coming. It's very rare people, if it's more than 5 kilometers, they come to your clinic for the treatment. So it's better if you focus on those places which are within the 5 kilometers, and there you set up your camp. So what exactly is done, you search, Google search or anything, especially maps, and then contact, just organize the this here I want to do a camp. So you call, you note the name, you call that place, take the email ID of the right person if a receptionist is talking, or email ID, and then call that person and organize, like, I'm this, I want to do this, and then set up a date, and things are easily done. Sometimes people might not respond, but it's okay, you on your behalf are contributing, you are doing a health checkup, even if the patient is not coming, but at least you are telling the patient while you are in the camp like what are the things, and you are doing your part. So you can mention like services dental, what will be full mouth screening of the patient, distribution of the mouth washes, toothpaste and medicines, you can take it from a wholesaler, or the MR sample that you give, you can take that in bulk. You can get associated with an NGO that provides the same. You can give a small presentation recorded, or you can present it live on the right brushing technique, pregnancy care, newborn babies care, teething, electronic brushes, cleaning, awareness of ortho, and about the periodontist who are specialists of children, and oral cancer screening, tobacco cessation counseling, right food quacks awareness, that the clinic should be registered and the dentist should be registered, a basic info you can provide about all this. You can take small gifts, stickers for the kids if it's happening in a school. You can make a handmade certificates for the kids, like you have a really good oral hygiene and oral health. So I was really confused that I'm not into certificates that much, because I don't want to promote that. I don't want kids to be running behind certificates. But then on other way, I want to, that should, oral hygiene, if they're doing it good, should be uh like supporting factor. The certificate should be like an appreciation thing. So you can just do it, you can make a post that certificate in a manner that it's kind of an good habit thing, and not something like a certificate, so that children do not go behind like I want to get this certificate. Sometimes what happen, if you are going on behalf of an NGO or a company who has hired you per camp basis, and they give you some amount of conveyance of coming and going, or some amount, just a kind of reimbursement, just a basic pay, that is fine. And sometimes they do not give, and that is completely fine. So it's you to decide how you want to go ahead with that. So sometimes in NGO what happens, there is dental, there is medical physician, and ENT as well. So you are part of the dental, and you have to take care of the dental thing. And the whenever you are organizing a camp, just get an idea of number of patients, the timings, the day. And for example, I honestly believe that 250 approx patients a day single dentist can see for sure. And if it goes beyond that, then of course we, I guess, need a, and it depends on the time slot also. If in like in school hours I have seen 250 patients, so it was like hardly 5 to 6 hours. For the camp is big, like 10 hours, I guess a dentist can see approx 300 patients. So it totally depends. Otherwise, if it's more than that, increase the number of dentists. So guys, here are the materials that you must be taking with you to the camp. Guys, since internship, like I have no idea how many camps I have attended, 25, 30, 45. I have no idea, I have stopped the counting. So another a very good suggestion, that if you're doing it on behalf of your own clinic, so do not share the prescription. Whenever you write it, get the prescription of photocopy. Because if you share your prescriptions, you are sending a lot of prescriptions. And there is another way, like if I'm getting a photocopy of the prescription and I'm giving it, so a patient comes to the clinic with that photocopy of the prescription, so I know that patient is definitely of the camp patient. You can get a portable chair x-ray as well, or for portable chair and portable x-ray, like filling, cleaning, x-ray, small root stumps, mobile teeth, for 1 day rent. Might few companies give x-ray like Vatek does, pus discharge, etc. Few minor procedures can surely be done on the portable chair x-ray. I will share the link down below. I think, I'm not sure, but portable chair costs around 25 to 35 range thousand rupees. But please do check the link for the confirmed prices. So that was the process. When you get into the camp, there is a registration, one person registers, like name, age, gender, contact number. These are the basic three. And more, if you need an email ID or specific details where the person is living, you can go ahead with that details on your own. You can just keep a notebook, and one person should write. You can take pictures, videos, record. One group photographs with the organizers of that clinic or the camp is must. Minimum 2 camps a year, I guess. No matter how good our clinic is running, it's like our duty. Every 6 months, 1 camp, it's nothing, guys. So I guess it's really important for that kind of contribution as well. This is the least we could do. It's like a fun day. We are learning, we are outing, we are exploring, we are get togethering. It's like a, we are working, but it's like a fun day. To give offers for the people coming from the camps, that should be there for sure. On the prescription, if you're just giving away your prescription, not getting a photocopy, so write somewhere, so that a person with who comes with that prescriptions, you get to know immediately that this is from the camp patient and which camp patient. On the prescription, mention camp, or if it's a card, there is a school card. If we go to schools, people might share, the school wants a card which they might provide, or we have to provide, so it depends. Or they will share the student's diary, or somewhere we can write so that it's in the record. Snacks is usually provided wherever you go, a little, having a good get together and little bit of eating. Follow-up procedures. If it's your clinic, you can do it. Concern or reminder call, and not a spam call. We do not have to spam and run behind the patients like, please come to our clinic and you got a checkup done. Just a reminder call, and especially once you're diagnosing while in the camp, the most concerned cases that require immediate treatment and you think that might, come, you can just write it on another small notepad immediately, like just name and what issue is it, perio, endo, whatever. So guys, I have a business idea. Why not to open up a company? You guys keep asking dentistry scope, what to do, what not to do. So why everybody's running behind a job? So the company, and that company just organizes camp. It is by the dentist, for the dentist, and for the public, with the dentist, for the public. So you can get even a Guinness Book of World Record by organizing the largest dental camp in India. Why not? And you must be asking, like, if I have so many ideas, why don't I do it by myself? I have so much to do, and I cannot do it alone. I need you guys, I need everybody. If you do so, that camp, do not miss me to invite. Another business idea: mobile dental van on road, like you are traveling across India from Jammu to Kanyakumari, east to west, and treating patients. Dental patients have one or two dental chairs on board, and why not do so? So guys, it's like, now dentistry in India is much more than opening a clinic and doing patients and sitting for long hours. Just mix. Do We are doing dentistry, we are practicing the right ethical dentistry, but we must be doing something extra, because that what makes dentistry in India different, right?